of older adult safety amid COVID-19 being put on by North Simcoe Muskoka Specialized Geriatric Services. Just to get started, I want to flag for everybody that this session is being recorded and will be put up on the NSM SGS website for future review. So because of that, we will ask that people remain muted and perhaps shut off your video during the course of the presentation. However, the real hope of this is that we'll have a bit of a discussion today. And so please put your questions in the chat box and we'll get to them at the end of the session. In regards to Zoom, just a reminder of some Zoom etiquette. If you would like to stop or start your video or start and stop to unmute, you'll find that in the bottom left. And the chat box is available in the bottom center, and feel free to write in there your questions. They will be monitored and posed at the end of the session. Just a bit of an outline for today. We're very pleased to have been able to bring together this presentation so quickly. We're happy to have Shauna Torkoff, who's the Public Education Coordinator with the Alzheimer's Society Muskoka, Constable Kira Brooks with the Barrie Police, and Inga Thompson, who is an occupational therapist at RVH, but is also here for the Prevention of Senior Abuse Network, Simcoe County. As I mentioned, we'll hold questions at the end, but as we got into December, the snow has arrived, and with the second wave of COVID-19, NSM SGS program has really been focusing on confinement syndrome and the impact that COVID-19 is having not only on healthcare workers, but specifically on older adults. One of our key mandates is education, and we do this monthly through our practice short sessions that everybody is invited to. You can find that information and connection details on the website. But this was brought together as a special session in the recognition that we know that winter is approaching, poor weather is here, and with some of the trends that have been happening with COVID-19, there may be some risk for older adults, and there was really a need to talk about the safety of older adults. As I mentioned, confinement syndrome has been a hot topic and a topic that SGS has been promoting. There was a special one-week education session in October focusing on confinement syndrome and the impact of confinement syndrome on older adults with the precautions that are taken as a result of COVID-19. If you are interested in any of those sessions and you missed them, please reach out to one of your PRCs and we can share that information as those sessions were videotaped. As a result as well of COVID-19, NSM SGS program is concerned for the health and well-being of older adults and their caregivers. We recognize that many of the support systems have pivoted to provide support in a different fashion, and there is a lot of caregiver stress and caregiver burden being felt in the system. As well, with the approach of the holidays, there is added stress, and so they really wanted to focus on the impact of wandering and how we can ensure safety of the older adult, as well as ensuring that people are safe and caregivers are well looked after. As many of us have pivoted, as I've explained, virtual care delivery has become the norm. And with that, there's increased risk for cybersecurity and cyber abuse. And so we're very pleased today to have Inga Thompson join us to talk about some of those associations. What we're really hoping to start today is just a conversation. And we know that each of these speakers, which we're so thankful that are here today, could speak themselves for 1 hour. But we wanted to give healthcare providers an opportunity to hear about this and start the conversation. And please look forward to a news release with some more information going forward. So as I said, please welcome the presentation, add your questions to the chat box, and we look forward to a very interesting hour. I'm going to introduce Shauna Torkoff, Public Education Coordinator with the Alzheimer's Society Muskoka.
Thanks for having me, Kim. Yes, as we come into the holiday season, an important topic, though an important topic any day, recognizing that each year in Ontario, probably around 8,000 people with dementia go missing. That is 22 people a day. recognizing that if someone is not found within 24 hours, often there's grave risk. So you can move ahead. So one of the initiatives that the Alzheimer Society provincially do is called Finding Your Way. It was developed as a 2014 initiative for the Ontario Action Plan for Seniors from the Secretariat of Ontario. An advisory committee was formed, including the Ontario government, the Alzheimer's Society of Ontario, and the OPP. The driving force was the concern over the amount of deaths that have occurred as a result of missing people in our province, recognizing Simcoe Muskoka independently. And many of us can look back just in the past few years and see the tragedies that have happened just within our own area. Go ahead. So one of the programs, when we talk about wandering, one of the programs is the Finding Your Way program. It's a program designed to raise awareness of the risks of going missing for people. It has a separate program just for first responders, care partners, and professionals. It helps prevent missing incidents by promoting the creation of safety plans, pre-safety plans, and the support of safe return of those that do go missing. So why is it important? Today, statistically, when we look at numbers just in Simcoe and Muskoka, we cover Parry Sound as well. There's roughly 14,000 people over the age of 65 living with dementia, and recognizing that about 60% of those individuals go missing. Half of those not found within 12 hours, as I mentioned, will become grave. Obviously, weather is a huge impact on the amount of success stories that we will see. 75% of those individuals that do go missing are found within a quarter mile of their home. Again, recognizing in our area, we live in a much more dense population with lots of water, so the risks are greater for those living within our area. Go ahead, Kim. So we'll talk about some of the preventions, but some of the initiatives that the Finding Your Way does and promotes are the Medic Alert Safely Home program. We have an identification kit that is specifically on the Finding Your Way resources that we'll talk about. It's imperative for us to preach carrying identification, consider locating devices we'll continue to talk about, involve neighbors. We always say building that circle of support is so very important. Understanding that the stigmas that run with exposing that you have dementia is huge. So hopefully decreasing the stigmas that go with that. Initiating buddy systems and create check-in systems and routines are really important. Go ahead. So I'm going to put it in the chat box as well, but Finding Your Way Ontario is a website that promotes the Finding Your Way materials. It has online, it has sections that talk about just first responder information. So it has discover materials, information, resources developed by our rapid response group. There's videos for those working in long-term care, retirement homes, and as well in the community. And they've put together videos that show the success plans of those that go wandering and how we as professionals can support those environments and those finding the individual. It talks about living safely with dementia. It's an interactive resource guide. It has building safe communities. It's a quiz, and it's really important that we all work in the field to really take some time and look and see how much we actually can still learn about those that do wander. As well, there's an online 4 online modules for education. It never hurts for any of us to continue to learn. All the materials are available in, I think they're up to like 14 languages now. As well, there's a printable resource guide explaining someone who lives with dementia, supporting someone with dementia, and an incident response checklist for those living with dementia, helping to ensure safe returns, as well as a post-incident checklist in the hopes that we actually get people home successfully. So the Finding Your Way website is available online. Sorry, Kim, is available online, and we both Simcoe and Muskoka have the booklets, and we are both more than willing on sharing them with anyone that would like them as a resource for yourself independently, your agency, or families that you know that could benefit from them. Go ahead, Kim, sorry. Within the resource guides and identification kit, and I know there's many identification kits put out there, but some identification kits, with this identification kit, it always has a picture. And it's so often that we have a picture sitting on our phones, but never printed. When the Alzheimer's societies are doing presentations, we will often take pictures at those educations so that people can go home and fill in their kit and have the picture, because we know the picture is one of the most important tools to help someone get home safely and for first responders to do their role. Within the kit, something that we find really valuable that a lot of them don't have, and it's an interesting one, is where to look and license plates. And though someone might not have driven for so many years, it's interesting how many people drive away and that's how they're found, is by the license plate. We just had a scenario up north, and the person was found and buried thanks to a license plate. So we were able to get that information out. And we know in crisis that people often forget the pertinent information, even what color someone's eyeglasses are that they've been married to for 50 years and the person hasn't changed their eyeglasses. So really important information that we think we know, but in crisis situations, we forget. Go ahead. So when we look at locating devices, I'm going to talk more in depth on this, but locating devices may be helpful to locate a person who's lost, or to allow someone with dementia to have increased independence, to allow increased independence. So it does not decrease the need to check in often, but it allows someone to have purpose for longer and for their care partner to feel more confident in them still doing things on their own. As well as the Finding Your Way initiative, Medical Alert Safely Home program was the OPP partnered with Medical Alert Safely Home. I know other police services are in talks with them as well in 2019. This was initially a program that the Alzheimer's Society partnered with, that the OPP has assumed. It allows police to better assist officers who are interacting with those living with Alzheimer's and other dementias. It's a new initiative. With that initiative came the Missing Persons Act, which was proclaimed by the government in 2019. And it provides police 3 additional tools to use when there's no evidence that a crime has been committed. The tools allow police to obtain copies of records that may assist in a search, obtain a search warrant to enter a premises to locate a person, and to make an urgent demand for certain records without a court order. So the Act also includes guidelines on what information police may disclose about a missing person before or after they've been located. It's a 24-hour service. There is a minimal fee. I think it's roughly around $60. I know it is a nonprofit, so I know there's always ways to work around that price. For those that know the Medical Alert bracelets, all it would do is have something written on the back that would say living or dementia, Alzheimer's. It could just have memory loss. It could have whatever we need. These devices are great. It's one initiative. We're not going to get someone that's never worn a bracelet to all of a sudden start wearing a bracelet. So we need to think of ways around that for all locating devices. With that, it helps if police are looking. It helps if someone has ended up in hospital. It helps if a first responder has contact and maybe they can look and they're recognizing the signs of dementia. And that's our role, is to then support first responders in recognizing the signs. The information from the Medical Alert bracelets are put in a database that is now accessible to all first responders. So one more tool. So when we talk about locating devices, it's a really tricky one, because though we have many, and many of us have heard of all different ones, it's also imperative to know that electronic devices impose restrictions on a client's basic rights, such as liberty, freedom, privacy, and their dignity. Such devices has been used for what they would know as locating criminals or tagging wild animals. So we really need to know what the person's comfort level is. And ethically, we can't make that decision to make someone wear a locating device. The balance between independence and safety is a real delicate one. While being lost is distressing for care partners and has the potential to be dangerous, having a safety plan or locating device can shorten the time spent searching. So we know there is value in them, but there is a big ethical importance. We know that GPS the GPS tracking devices have been relatively successful. There is many areas that we cover within just our own Simcoe Muskoka where they don't even have cell service. So recognizing all of this, we are looking at people are using the phones. We have everything from the bracelets to the phones to the insoles. These are all great if they're used, right? But someone who is wandering often isn't thinking to take their slippers off to leave the house, to put their shoes on that have the insoles, or remembering when they get out of the shower, because many of the locating devices that are bracelets and watches aren't waterproof. So when we take them off, are we remembering to put them back on? So it's providing care partners some comfort, and those living with dementia that have insight to recognize that they're living with dementia. It does provide them more, it does provide them some independence longer. Radio frequencies, I know Constable Brooks is going to talk on Project Lifesaver that is accessible in the Barrie area, not for us. And cell phones have been imperative. I actually have a client right now that he's no longer mobile, so his care partner is taping it in his scooter. So it's taped in there, so he can't go out without it, and he, without exaggerating, he probably wanders off about 3 times a week. So it's always there, and it's her responsibility to charge it. So there's always an exterior. So if something's not charged, nothing's good. Go ahead, Kim. So thanks. So we can get those pamphlets out to anyone that wants them, and I will put in the chat box the website for you to access. There is the quizzes on there, and there is the education tools on there, and they are super valuable information.
Great. Thank you so much, Shauna. As Allison had highlighted, please feel free to put your questions in the chat box. We're hoping for some time at the end of the session today. I'd like to take the opportunity to introduce Constable Kira Brooks to speak about Project Lifesaver, and she's from the Barrie Police.
Hi, everyone. I hate that my computer is 2 different sites, so I might not be looking at you. I apologize for that. I just want to say thank you to Shauna very much for your valuable information. It is wonderful that helping find our missing vulnerable persons is so vital, especially coming these cold months. As you probably know, we had a missing person a couple of years ago that ended tragically, and it is very, very sad when that happens. So thank you so much, Shauna. We also, which I don't have a slide about, have paired with Medical Alert. And I'm super excited about pairing with them because we are available to have all of that medical information, where they're wandering, what they're doing. But we also have a vulnerable person registry ourselves. So although Medical Alert does cost $60 a year, and that's the minimal cost for the regular bracelet, and the maintenance every year is $60. Our vulnerable person registry is free. So if you do have someone who lives in our community, then they can put their loved one on our registry, and that includes their information as far as their date of birth, their address, where they might wander, some triggering factors, very much similar to Medical Alert. We had it before, and we're continuing to keep it along with our partnership. So it's exciting, and another tool in our toolbox, just like Shauna said. So that's really good. The registry is, do you want me to answer any questions if I see them, or do you want me just to keep on going, Kim?
If they're relevant and you have time, feel free. Okay. And otherwise, we will have time at the end. So whatever works for you.
Okay, my presentation is kind of short. It's just an overview. So the Vulnerable Person Registry is only for Barrie residents. Aside from that, OPP has stopped doing the registry, and they've only paired with Medical Alert. Now, talking about the Project Lifesaver program that Shauna touched upon, it is a tracking device. It is an expensive tracking device. You can see it on the screen. It is a bulky wristband device, but it, unlike a cell phone, it doesn't emit a cellular frequency. It emits a radio frequency, which is much different. So here at the Barrie Police, where we're located at our new location at 110 Fairview, we have really crummy cell service, and a lot of places in the city of Barrie do, and probably out in OPP country as well. Whereas this Project Lifesaver bracelet has the radio frequency, which is admitted everywhere, anywhere, so you can find it. The program was established many years ago and runs all throughout North America. And it really is designed for at-risk individuals. Because of the cost of the program, not everyone is going to get this, nor do people always want to wear a bracelet or another device, but it does help find people. It's another tool again in our toolbox, which is great. So like I've said up on my screen, Alzheimer's patients, autism, brain injuries, mental health conditions, an array of different things. We even have bans here in Barrie on children. So we have 10 people in the city of Barrie that have been assigned with a bracelet. I think I might have another slide on this one. Yes, so like I said, it's just a small watch-sized frequency signal. So what we do is, you can see the police officer, they're holding a cellulite receiver. What ends up happening is if someone goes missing, we will set up that frequency satellite and emit the radio frequency that will pick up that bracelet of the last place that that vulnerable person was last seen. So if that person was last seen at Tim Hortons, for example, we're going to set it up there and we're going to track it and we're going to move in the direction of where the bracelet is. Sometimes we don't find people, sometimes we find bracelets, but it will find someone. So currently right now, Barrie Police is in partnership with Project Lifesaver. OPP is partnered, only Collingwood, Orillia, and Central regions so far. They are working their way around the area. However, and South Simcoe. However, I do want to make mention, let's say we've got snowbirds. We've got tons and tons of snowbirds in the area and they want to go to Florida. Because it's all over North America, the great thing is you can contact your local sheriff's department and say, my loved one is on Project Lifesaver. Do you have a frequency transmitting device in case my loved one goes missing? And they will be able to put your name on their file and call out. Much like if, for example, someone in the OPP territory or outside Barrie goes missing, and then what ends up happening is they'll dispatch someone to come and assist. Barrie Police can come and assist, and we've had South Simcoe come and assist with locating people before if one of our machines is down. We have 2 machines, so we could have 2 people set up, and everywhere it's picked up, you move the receiver to the next location. So I am not selling this. We are not selling it. It's just we're in partnership with it. The cost of the bracelet is $500, so it is costly, but we do try, they do try, sorry, to work with a patient if required, that they don't have enough money. It's $120 annually. It needs to be charged the battery. Just like Shauna said in her presentation, if your batteries aren't charged or things are dead, then it's of no use. There are other devices out there. There might be better ones that we don't know about. I'm not sure. This is what we've got right now, and this is what we're dealing with. So caregivers get a little package from Project Lifesaver, and they get stickers for their fridge, stickers for their door. So it reminds their loved ones who to call and what to do, because you're panicked when you have a loved one go missing. And then they've got information in the database, and they have to register on our vulnerable person registry so that we have all of their information as well. So it's at the fingertips of the police officer and the search team. So all the caregivers have to do is just help with changing the batteries and contact if there's any information. So the phone number is listed below, and you can't see my whole slide, but the website is listed below too. You want to switch slides? So I'm just going to get into a little bit of another project that we work on, which is TELUS Wise and Cyber Seniors. So the great thing about TELUS Wise that we love working with, we are partnered with them too, is seniors can use this service free of charge to log on and get various websites, tons of workshops, tons of discussion. It's funny, yesterday I was talking to a senior talking about Project Lifesaver, and her husband was just sitting there oblivious to what was going around with us, and she was missing her programs. And I said, why don't you log on and get some of the programs that they're offering, resources, conferences, calls, whatever. And she goes, they're boring. Honestly, Kira, they're boring. I don't want to sit on a computer. I want to be out talking to people. So that's going to be a really big challenge that we face, which is sad. But we're working on it with our different groups, such as PSAN, which Inga is going to talk about, which is an amazing networking group that we all share different ideas and try to provide resources in our community. So Tell Us Wise has lots of workshops you can sign on and sign up for weekly workshops. They also have these amazing booklets for cyber safe security. And in them, they're all great big print, so you can read everything you say. There's check boxes in here, setting strong passwords, all sorts of things contained within this booklet. So what I've done is I've taken this Tell Us book and I've created a PowerPoint presentation that I share with various organizations in our community. I've been doing a lot of online frauds and scams talks. I liaison with the Canadian Anti-Fraud System. I'm so sorry, I'm looking all over the place. I can see my head and I should be looking right at you. We are trying to work with Canadian Anti-Fraud to make sure that we are bringing you the most up-to-date current frauds and scams against our seniors right now. So I am offering those workshops and they are successful. Some people have canceled. Again, it's probably because of the feedback we're getting with the fact that they're just getting bored of the Zoom presentations. I do include some videos to try to keep them engaged a little bit more, and I will drop off any of these kinds of flyers. The little black books of frauds and scams I also provide. And we also have tons of amazing resources in our Cyber Seniors website too, which I believe is my next slide. So I'm missing a bunch of slides here.
I think feel free, you have time, Kira, so feel free to just speak to them because I feel that I might have the wrong slide deck pulled up or less.
Yeah, I think so, because this isn't my slide, but that's okay. So I'm just kind of a little bit off because I'm wondering what I'm going to talk about next. The PSAN group, like I said, is an excellent opportunity for us just to mix in with some of our community partners and we share things. So if PSAN, Preventing Senior Abuse Networking Group, wants police involvement for something called It's Not Right, it's an organization. Sorry, I'm just going to try to pull up my slide so I don't miss anything, but It's Not Right is such. Can you guys still see me?
Yes,
okay.
And I'm happy if you have it pulled up. If you want to share, we can quickly do that.
That's okay. I'm almost done. So It's Not Right is a very valuable resource. Pauline, our chair of the PSAN committee, works a lot with me. A lot of us are trained on that specific committee to offer presentations for It's Not Right, which is talking about elder abuse. So obviously a lot of you are already partners and taking care of seniors or vulnerable people, and elder abuse is obviously any action or inaction by any person which causes harms or threatens to cause harm to an older adult. So we touch on what financial abuse is, what physical abuse is, psychological and verbal abuse, sexual abuse, neglect, and spiritual abuse. And we offer these programs. So I have actually done this presentation for the Parkinson's Society just recently. It's a group that Liz McGuire puts on together. She's asked me to do it for her, and during COVID, since we're not seeing the seniors, I've been doing much of that. So we've been working together to get the message out there about It's Not Right. And then my final talk that I wanted to talk about, and I have a website for that as well, if anybody is interested in that. And my final slide, I'm just going to click over to it. I wanted to talk on the Cyber Seniors, Cyber Seniors, but I do know that Inga is going to talk a little bit about it. But the main goal of the Cyber Seniors is just to bridge that digital divide between our generations through technology. A lot of the seniors are scared to go on it. They're afraid of the frauds. They're afraid of the scams that they're going to get locked into, which unfortunately they are really getting locked into, especially with the Shoppers Drug Mart. They all use their points cards, they log in, and then they get scammed. The Cyber Seniors offers weekly courses that are so amazing. If you get a chance, I even find value in them. If you get a chance to go on them, definitely do so. They also offer a one-on-one consultation with a tech person. They pair up with a younger person for a senior for a call. It is wonderful. So again, just signing up for daily webinars, and you can watch previously recorded webinars. So all of this is really valuable information. And if you have any more questions, please feel free to ask me. Sorry if I seemed a little messed up, but I'm happy. I can be reached at, if you want my email, I think Kim can pass it on to anyone. If you want a video or a Zoom meeting for any of your vulnerable communities, we've done them for Empower Simcoe, and they actually put it on their website, keeping their vulnerable communities safe from, graphic pictures or sending pictures online to each other, that sort of stuff. So anyway, that is it from me. I'm going to pass it on to Inga, I believe.
Hi, everyone. Can you hear me?
Yes, we can, Inga.
Don't know if you can see me yet, but I'll just start and hopefully you'll pick up my face in a little while. So thanks again to Sandra and all the people at the SGS group, and also to Shauna and to Kira. As Kira has mentioned, we are a network, the Prevention of Senior Abuse Network, Simcoe County. We've been around for a while. I personally have been involved in it since the start, which was back in 1996. Although we are, I think we're a bit of a quiet network. There's still a lot of people who don't seem to know very much about us. So we're maybe not the greatest at promoting, but we do focus in on awareness and education. We are not a response network. We don't have people on the network that specifically go out to respond to elder abuse, other than if that is part of the mandate for their own agency. So we cover various sectors. Police is obviously one of them, healthcare, social services, retirement homes, long-term care, all those people. Anyone that's of interest to the topic of elder abuse is welcome to join us. We have many members who stay connected to our updates through emails, and several who come to our meetings, which of course have changed into Zoom meetings in the last year or so. Kira just gave you a definition of elder abuse. I'm going to give you another one. A single or repeated act or lack of appropriate action occurring within a relationship where there is an expectation of trust which causes harm or distress to an older person. This is the definition that WHO, World Health Organization, comes up. And there's some parts of that I think are very relevant to the situation that we find ourselves in. I think as well, Kira talked about the various types of abuse: physical, financial, sexual, psychological, verbal. But I think it's also important to recognize that it can also be as a result of intentional or unintentional neglect. And I think we may kind of be recognizing some of that within this present situation that we find ourselves in. So if we go to the next slide. Okay, so I'm going to focus a little bit on how COVID is impacting on seniors in terms of elder abuse, but also talk about how it's also impacting on caregivers and even ourselves as healthcare professionals. It certainly have an impact that can cause difficulties for our seniors. The whole focus of COVID has been to reduce contact in order to try and prevent the transmission of the virus. So we've really seen a significant impact, all of us, in the interpersonal contact changes that have occurred. So With seniors, we also recognize that they are at the highest risk for serious illness or death if they catch the virus. And we've seen something like 80% or more of those who have died have been seniors. So that has obviously exacerbated our need to protect. But we have to recognize that these protective measures that we take also have negative consequences for our seniors. And although we tend to be a society that tends to want to protect our seniors, I think Ciara kind of mentioned some of the seniors are sort of really feeling like it's time to let us do what we need to do and what we want to do. So recognizing some of the impact that this isolation has or can have on seniors, the social isolation itself results in limited access for caregivers, supports, even healthcare providers to be able to kind of come in and offer that care. But they're also losing the companionship, they're losing the contact, they're losing physical contact, they're losing social contact, and so they're becoming more withdrawn. There can be significant financial hardships that are occurring for seniors in this. Recognizing just the whole global economy that's occurring, some changes in stocks and investments, retirement savings, this is having an impact on some seniors in terms of their income. I was listening to the Doc radio this morning, and Meg is up there at the Midland Food Bank, and commenting, one of the comments that she made was that they are seeing a huge increase there of seniors having to access the food bank due to financial concerns. So this also can result in kind of codependency that's occurring with other caregivers. And as Ciara mentioned, the increased vulnerability to scams. I think that we've all heard all the various scams that's been going around these days, and seniors are particularly vulnerable to that. I read something not that long ago about a place down, I think it was in Kitchener, where a person in Shoppers Drug Mart had stopped a senior who was busy trying to collect $3,000 worth of gift cards because she was being scammed. And thankfully, this lady intervened and helped the senior recognize that she was being scammed. But those are some of the things that are occurring for our seniors. We also recognize the physical and mental health changes that are occurring. It's harder for seniors to access the services, but it's also harder for seniors to access supplies and things that they might need for various illnesses that they have. And so that might mean that they're not getting medications the way that they should be getting, or supplies, things for diabetes or for wounds or incontinence products, any of those kinds of things. This is also resulting in less movement. So we're having issues with regards to falls risk, which puts them at high risk as well. And definitely from my perspective, I work in the mental health field, and we can see the impact that it's having in terms of depression and anxiety. Seniors are very resilient, and I think one of the things when COVID first started and everybody got shut down, I had several people ask me whether in fact we were seeing an increase of people coming into hospital because of COVID. And the answer at the beginning of this was no, not really, but it's definitely occurring now. I can think of at least 4 seniors in the last month that have come onto our floor who have all stated that one of the biggest reasons for their change in mood was the isolation. So the resiliency is breaking down, that is for definite. The higher anxiety that's there, and the increased use of drugs and alcohol. So those all put seniors at risk for their own neglect, but it also puts them at risk for abuse as well. And one of the things that's also becoming very apparent is the ageism that's occurring within all of this. We are a society that I think has to acknowledge the fact that there is a lot of ageism, along with a lot of other isms that exist out there. But ageism is there. The whole protective measures that we take kind of indicates that we view seniors as being helpless, frail, they're not able to contribute to decision making. But what we're doing when we do a lot of these things is we are taking away privacy, autonomy, and dignity. I had a conversation with a senior friend of mine, kind of in the early stages of the COVID, where her family was being very protective of her. And they were doing this with the very best of intentions. It was, you know, her grandson in particular kind of said, "Grandma, if you need anything, just let me know." And as she said, there are just some things that I buy at the pharmacy that I don't want my grandson to know that I need. And those are the kinds of things that we forget, that we take away privacy from seniors in this situation. So let's talk a little bit about how this impacts on caregivers, because that is very prevalent too. The financial strain that occurs, there's a lot of people that have been put out of work or on furlough or are not earning as much as they were earning. So this puts a lot of financial stressors on people. This can result in that codependency. They're relying more on their seniors who may have some money and maybe taking advantage of that to some degree. The seniors themselves, the caregivers themselves are dealing with a lot of stress. There are more demands on their time. There's more homeschooling going on, so they are often in that sandwich generation situation, but they have all generations under maybe one roof at this point in time. The children, they are trying to work from home, them having to put time into that. Maybe they're trying to work from home at the same time as well. So there's increased stressor. They themselves may be finding use of drugs and alcohol as being a way of coping with all of this. And we have to acknowledge that they also have lost access to support systems, even if it's their own friends, the people that they can talk about how their own struggles, and they can just bounce ideas off. They may not be able to have access to that, not to mention the medical system that may have been supportive of them, the healthcare workers, the PSWs. So many of those are still going into homes. Some of that's been reduced, and some of the contact with the caregivers has been reduced. Just the fact that the stressors causes their own mental health issues, their mood changes, their ability to deal with stressors, their impatience, intolerance can change, and that can result in the possibility of them being unintentionally abusive. So, and we have to recognize that some of these people were living in a situation where abuse was already occurring. And so you add these extra stressors and strains into it, and now we have the increased risk of severity or even resulting in sort of lethal actions. So, and the fact that there aren't so many eyes on the situation means that they're less likely to be identified. So people who might have been aware as not now, then people are not coming into the home, they're not able to actually see this as well. So when we start to take a look at how it impacts on us as healthcare providers, I think that, I know I work in the hospital, so of course, my clients come to me, but I know many of you work in the community, and I've had conversations with people where they've talked about the fact that they have to telephone calls, Zoom calls, where possible. Telephone calls are wonderful, but you don't get to see the whole picture. So the inability to do your assessments as fully as possible when you're just hearing a voice. You can't see the environment. You can't see whether the person is looking a little bit more unkempt and not taking care of themselves so much. It's harder for us to remember necessarily all the things that was going on when you've just got a few minutes on the telephone with someone. So that can reduce our ability to be connected with the seniors ourselves. Everybody's being pulled in all directions at the moment. There's new pressures, new policies, new procedures, and those change daily often for some things. And so trying to stay on top of all of that, so trying to remember what we're supposed to be doing, when we're supposed to be doing it, and how we're supposed to be doing it can be problematic. And that can divert our attention in lots of different ways. Not to mention our own individual fears of the virus and the worry about being someone that's bringing this into a situation, into a home. And so that adds extra stress. Initially, there was some limitations in PPE equipment. So certainly at the beginning, I think that kind of caused a lot of stress and strain for people. But that's hopefully been resolved now. But even just the fact that to go in and to go into these environments, everybody's got to be gloved up, gowned up, goggles, whatever on. And again, that just changes that interpersonal relationship. No physical contact, where you may have been someone who just put your hand gently on the shoulder of someone. That's not allowed now. And so those kinds of things can really put a strain. And we have to be aware and very conscious of the fact that, you know, that the out of sight, out of mind attitude can result in us just simply kind of forgetting about some of these things and some of these people. And it's hard for us to acknowledge that fact, but that can be the reality that we have to deal with as well. So what can we do? So I think, you know, as people have said in the past, it's important to try and maintain as much as possible face-to-face contact, doing so in a safe manner. Seniors are definitely telling us that. We've talked about technology, and we've ensured that we try to ensure that all seniors have access to that. Not everybody does, and not everybody that does have access is comfortable using that. I've certainly had that conversation with 2 or 3 seniors that have been on the floor with me. Yes, I have a tablet, but I'm not sure how to use that. I don't think I'd be comfortable doing those kinds of things. So trying to assist seniors to get that comfort level would be really important. Cyber seniors that Kira talked about is excellent. For a long time, she talked about TELUS, and I thought we were talking about the same thing, and discovered there's actually two different organizations there. But the cyber seniors really does have that opportunity, and that one-to-one is important, and that mentoring, the intergenerational component with mentors, are really helpful as well. But for some people, it's still difficult. It's still hard. We need to make sure that we continue to develop our skills and our comfort in terms of talking about abuse and responding to that. You know, asking the questions. You know, we have to ask how they're doing, are they feeling safe? Do they have any kind of concerns? Is there anybody making changes to things for them, their financial situation or whatever? So, you know, ask those questions. When we do video conversations, then don't just look at the person, look behind them, look and see what's going on in the environment. But when you're looking at the person, consider, how are they looking? You know, do they look like they've had a shower? Do they look like they're washing their hair? Any of those kinds of things that are really important to kind of take a look at. Make sure it's a safe place to talk. Make sure that they are comfortable talking to you, that they can share, that they feel that their concerns are being listened to. So, but in addition to the senior, support the caregiver. You know, you need to kind of talk to them, maybe private conversations. Everybody kind of has this one conversation, and we encourage the caregiver to be there so they can contribute to that, and that's fine. But maybe occasionally just make a call to the caregiver and just say, how's things going? How are you doing? And asking about their safety and their well-being. Remember, sometimes it's the caregivers that are on the receiving end. Dementia often lash out, and they may be struggling with that. So talking to them. And talk about resources and supports for them. Offer counselling, problem solving, referrals forward if need be. That's all really important. But also collaborating with others who are also connected to the seniors. So, you know, family, friends. We have where we did have collaborative body, the situation table. Kind of sometimes there are a number of other resources. We tend to get caught up in our healthcare resources. You know, the police are excellent. I know we've talked to them a lot about the contact, the wellness visits that some of the police do, that just go in and check on people. They can do those kinds of things. And so utilizing some sectors outside of healthcare may be really beneficial for us to do as well. And make unscheduled calls if possible. Sometimes if you plan a call, then in addition, everything can be organized at that time. Everything can be made to look great. The senior can be prepared, or the caregiver can be prepared. So sometimes just making an unscheduled call might give you the real picture. So doing that is important too. And share resources. So if we look at the next slide, there's lots of resources. I could mention lots more. There is the senior safety line there. Make sure all seniors have got access to that. Local care providers who you work with, any of those, the local and provincial police, are excellent resources there. The Prevention of Senior Abuse Network, and we have a website, we have a Facebook page. We're trying to constantly on our Facebook page put up things, you know, the latest scams that we're aware of, or information from the frauds, or from Elder Abuse Ontario, Elder Abuse Prevention Ontario. They have lots of different webinars that are of interest to people, so get yourself registered with that. The Neighbours, Friends and Families, the It's Not Right campaign that Kira talked about. you know, but also just kind of using neighbours and friends and families as well. They're a great resource. Cyber Seniors, we talked about it already. Telehealth Seniors Without Walls, that's the City of Barrie that's doing that. It's where the seniors social group now is done virtually. It is open to anybody in Simcoe County, not just Barrie residents. So, and they do have a lot of kind of social activities and events that occur, as well as they do presentations and information as well. Jikamic, in terms of virtual programs, there's lots of them. The family health team, I looked at that website as well. They often also offer things in terms of physical well-being, mental well-being as well. Advocacy Centre for the Elderly has great things in terms of elder abuse to kind of take a look at. Canadian Bankers Association, they have lots of stuff as well in terms of financial abuse to try and reduce the risk for that as well. So as I said, the list can go on. So just kind of take a look at what else is out there. So my last slide kind of talks about future considerations. I think that this has been very apparent that we need to start involving our seniors in policy making and local and provincial level. Elder abuse needs to be acknowledged. It exists, even if it's unintentional, and even if it's done, you know, in terms of stripping dignity. We have to be very cognizant of that. So continue to develop our collaboration with various sectors. We've got to come out of our silos still. I do think that's one of the advantages of being part of this network is it's not just about healthcare. It's about social services. It's about, you know, the police. It's about, you know, legal situations. So we need to kind of be more connected with them. Create a safe place, which might include looking at housing. We haven't really got anything in this area that's a safe house for seniors. Crisis housing has still been a major issue. We need to kind of take a look at that. We need to kind of advocate for the courts and the legal system to have this on the radar better. And we need to create bulletins regularly to inform and educate our seniors. So there's, again, more things that we could put together. But I just want to end with a couple of things. One is a quote. We recently did a survey through the network, which was asking our seniors, you know, how do they want to receive information? We're no longer able to go out and do presentations. So this was one of the quotes that came back. Please consider that seniors have been virtually locked up for 7 months and do not want any more virtual stuff. We need exercise, fresh air, and socialization, but no one will listen to us. Enough with being segregated. All anyone has done for seniors since March is tell us what we can't do and offer us things that we can do inside alone. That's not good for our minds, our spirits, or our bodies. Why won't anyone listen? So I think it's important to do that. And I have one last little quote. This is from a caregiver, acknowledging, we were talking about the confinement syndrome, and this person who also works in healthcare said, I'm witnessing this with my own mum. Noted cognitive decline and huge decline in her physical abilities and stability. She had a dental abscess the last 6 weeks and 3 of her front teeth fell out with 2 roots that needed to be removed. She's being fitted for a partial plate, but can't get in to see the oral surgeon until December the 3rd. This was at the end of October. Hearing aids needed to be replaced, and so hearing loss for the last 3 weeks, which has compounded her frustration and ability to understand and communicate. So the retirement home is doing an excellent job of keeping tight protocols related to COVID. They'd shut down all regular house programming since March, which has been detrimental to the well-being of all the residents. It didn't make sense that they were not continued safely within the retirement home. So again, just the impact that this has been having on our seniors. We just need to be more aware of it. So thanks, guys.
Great, thank you. That was wonderful. Great presentation. I just want to flag for people, feel free to put your questions in the question box. There are a couple, so I will highlight if you've been looking through to the chat box. And one of them, Gina's asking, great presentation, what are we going to do to address it? Donna had asked if there was funding for some of the devices, and Constable Brooks had highlighted that through Medical Alert you can seek some of that. She also commented about care partners who may not be intentionally not meeting the needs of the person that they're supporting, and if there's any resources available for those. So I'm wondering, opening it up to the speakers, but also to any of anyone on the call today. Lots of thank yous.
Kim, it's Sandra. Can I just go back to Gina's question around what are we going to do about it? And I think now more than ever, we all have voices. We have to tell the stories. Inga, those last couple of pieces that you shared were extremely powerful. They told the stories of what people are experiencing. We're trying to do a little bit of stuff around storytelling probably in January, so I may reach out to you about that. But we all have voices and we all have to advocate for the health and well-being. And it's totally finding that balance between keeping people safe and giving them the freedom to do what they need to do, that dignity of risk and the right to failure, but trying to keep it safe. And that's the balance we have to push for. The control is still way too far resting in the healthcare field, and I understand why. But in the meantime, we have constrained so many of our older adults that are lending to, and it's lending to all of these situations.
I just want to add as well, in terms of the Elder Abuse Network, we do have a website and we do have a Facebook page, but I'm more than happy if anyone is interested in being on our distribution list. I am the secretary for the network, so I have a fairly large distribution list that I regularly send out information, including stuff that's coming from Elder Abuse Ontario, and anything else that kind of comes out in terms of stuff for seniors. So, even if you just want to keep an eye on what we're doing, you can get the minutes from our meetings. We have them monthly. So if you need to get in touch with me, you can do so. My email is Thompson, THOMPSONIN, at rvh.on.ca. So again, thompsonin@rvh.on.ca. So feel free to contact me through that and I can put you on our distribution list.
Inga, it's Allison J. Awira here. I just wonder if you're able to, if you want to type your email address into the chat box, feel free to do so. And if you're not able to, we will definitely get your information out to people.
Okay, I'll try.
Before we close, I just want to make sure there's no other questions for our panelists. There's a question around whether we're able to share the slide deck. I guess I didn't really clarify that prior to our session. Sandra, would you be aware of whether we're able to share the slide deck at the end of all this?
I would be fine with that, but I would ask the speakers. I would ask Shauna and Inga and Kira whether you would be comfortable with that being shared. Sylvie, it is, we have videotaped this, so for those that came late or those that weren't able to make it, it will be on our website likely in the next week or so. But yeah, it looks like it's okay with Kira, it's okay with Inga. Shauna, you're good. I see you nodding your head. Yeah, so if anybody is interested, please feel free to reach out to, you can reach out to me or Julie. I think Julie booked it. No, just reach out to me for those of you that know me, or reach out to one of our team members or contacts and we'll get it to you. I'll throw my email address in here too.
Sure, that's great. Or I encourage anybody who is connected with one of your psychogeriatric resource consultants to absolutely reach out to one of us and we will help provide that information. On behalf of everyone on the call, at one time I tallied about 90 people, so I was holding off sharing that with the presenters until after you presented. It was wonderful. I would like to thank each of you, Shauna, Kira, and Inga, for the incredible information that you have provided for us. I think all on the call would agree that we have our eyes squarely focused on ensuring safety for the people that we support, and knowledge is power, and I feel the information you've provided for us and the resources you've provided for us have given us food for thought and more work to be done. So I very much so thank you, and I thank everyone for attending our Lunch and Learn. And as Sandra had mentioned, this video will live on the SGS website and we will make it available to anyone and everyone. Thank you very much.